Morning. I don't know if you guys can hear my music in the back, but I'm over here jamming, just dancing. I'm like, oh, I got to go live. So here I am, and I'm sure I'm going to have to turn it off in a few minutes, but so hopefully my internet is okay. You guys are all here. You can hear me. Give me a thumbs up. Let me know while I sit here and dance and wait for you. I miss dancing on my lives, but you know, there's a lot of issues sometimes, especially with Facebook. So here we go. So here we are today. Good morning. It is Friday. It's live Q&A. Dr. Trisha Pingel here. Totally excited to be here and to talk a little bit about some of the stuff that's been in more recent news, which I don't know. I'm going to be a little bit honest and raw and straightforward because some of it just cracks me up in regards to hormone therapy and like all these new discoveries that, oh, wow, there's actually benefit to it. Gee, who knew? But I also think that it's always important for discussion because there is a level of customization and understanding of the body that has to happen in order to use hormones. Like, it's not my fear here, and I'll fill you in on the study, is that people are just going to start to go rogue. So I'm going to let you guys pop in here for a second. We're going to talk a little bit about hormone therapy during the open, and then I'm going to jump into questions and live Q&A. So you guys can start putting them out there if you want. How's my connection over there on Facebook, LinkedIn, and YouTube? It looks a little shoddy. So if you're over there, can you give me a hello, a good morning, something? Let me know that we're okay. My internet is good, but it says my stream internet is not. Looks like Facebook is up to go. Yeah? We all, or Instagram, we're all good, right? Okay, cool. So I want to talk about, maybe some of you have seen more recently in the news. Hi, Michelle. Thank you for saying happy Friday. You've seen more recently in the news, they're like, oh, we've been doing a review of hormone therapy. And for years, we've always said that it causes cancer. And now, oops, it doesn't. Now it's totally fine. It actually has benefit to women. And so, so I want to talk about this a little bit. First of all, I want to hear your thoughts because I can absolutely say throughout my career working in the endocrine system and doing hormone therapy, you know, this has been a discussion over the years. You know, can I do hormones? Can I do hormones before menopause, after menopause? Can I do it if I have a family history of breast cancer? What if I've had breast cancer? Does it cause breast cancer? This has been a debate between the functional and naturopathic medicine world and the conventional world for ages. And I feel like we've held our ground here on our side saying, look, if it's done correctly and you're paying attention to all of the systems involved in hormone management, hormones can be incredibly protective to the body, right? But they're always like, no, we can't do it. Well, now this study comes out and here's my fear, right? You guys want to hear what I'm afraid of? I'm afraid that now that the conventional world has been told that it's okay to do hormones, that they're going to arbitrarily just start prescribing them. Just put everyone in the same box, put every woman on hormones, and not monitor them appropriately or pay attention to the stress response in the body. That's my fear. So here's what I'm going to do. I'm going to educate all of you on this so that if you get to this point where you're contemplating hormones or if you're on hormones already, you have a little bit of ammo to understand what do we need to ask? What do we need to do? What's the truth? What's not? Is that fair? Is that a good conversation to open with? I got some hearts on Instagram. Happy to see it. Cool over there on the other side. If this is of interest to you, speak up, say yes. So one of the most important things to remember when it comes to hormone therapy, in my opinion, is you have to recognize the impact that cortisol and the adrenal glands have on hormone metabolism. A lot of the times, the reason why you are having hot flashes or not sleeping well or irregular cycles or, you know, all these symptoms of menopause or perimenopause, a lot of the reason why you're having those symptoms is not always that the hormones are low. It could be that they're not being utilized appropriately and they're being stored, causing an imbalance. So number one, you must not just give hormones based on the symptom. Okay? There needs to be an evaluation of the thyroid, the blood sugar, the adrenal glands, the sex hormones at the right time in the cycle. nutritional markers, inflammatory markers. We need to consider other conditions that your body may have that we need to work with that could be causing stress on the body, okay? These have to be considered first because that dictates the treatment. So a hot flash could simply be due to an irregular cortisol pattern. It may not even be your estrogen or progesterone, but we don't know until we look. And when you look and you look at those balances, the treatment comes quite clear. Now, if it comes down to, yeah, hormones are struggling here and we do need to consider adding them, I still, even though they've now said all hormones are fair game, go for it, I still lean to the bioidentical compounded hormones because I don't know any two people, men or women, that are identical. Even twins. Hormone systems can change. Lifestyle can change. The stressors on your body are different. The way you handle life, you live life, are different. The nutrition you put in your body is different. So we can't assume that every single woman, when they start to get hot flashes, should get the exact same prescription. That would be silly. And to be honest, that was my complaint before. And when they were looking at, well, are these people getting a higher risk of cancer? Is this safe for them? Are they getting endometriosis? Are they having estrogen dominance? I think a lot of the time it was that they were giving hormone when they didn't need hormone, right? It wasn't the hormone that was the problem. It was the prescription at the wrong time to the wrong person. Does that make sense? So my fear with this new news story, which now like unleashes, hey, hormones are great, go ahead and give them, is that people are just going to start writing them and not actually doing the investigation. And it's really, really important to do the investigation. Yes, really important. Okay, because sometimes it's an imbalance rather than a deficiency. And I see this a lot when people use pellets. They use them inappropriately. They say, oh, my libido's tanked, you know, I'm having hot flashes, I'm not sleeping. Oh, well, we're going to give you testosterone and estrogen in a pellet. And then it gets worse. And they're like, I don't get it. Well, because perhaps the body was in an adrenal fatigue state. And when you put the hormone in, it converted it into cortisol. You know, as I've always said, every time I show up here, I say, you know, cortisol will win every time. And there's no harm in relaxing more. And there's no harm in spending more time in a calm state and a parasympathetic state. I don't see any harm in that. So it's important to learn how to do that, especially when we're talking hormone therapy. I'm going to sneeze and I'm going to sound like a cat when I do so. Told you. I don't know where that came from. So I want to open this up to some comments on this. Is this interesting to you? Have you guys read about this? I'd love to at some point get on one of my good friends, Dr. Jen, who works with breast cancer, to talk about hormones and things like that, because I think there's been so much confusion surrounding it over the last 20 to 30 years. And now nobody knows what to believe, right? And the bottom line is it comes down to you need to have a physician on your side that looks at your body holistically. I don't care what we say. There is not one herb or one nutrient or one prescription or one that is going to cure anything, right? These are about supporting the body for the body to live the best life that it's have and have the best energy production. So you can't just look at a symptom and treat it. You have to look at the whole body and you have to look at the whole picture. It is required for any single treatment out there. And I get that question from you guys all the time, like, well, what do I do for X, Y, and Z? And I'm like, well, why is it happening? I can't answer it if I don't know why, right? And sometimes we don't know why. You know, there's acute protocols that you do to just get through a symptom, and that's cool. But then at some point, we need to look at, well, what is the body trying to tell us and why is it trying to tell us that? And then how do we remedy that, right? Yes, from Michelle. Thank you. Hi, Richard. How are you? Yes, Romania. Yes, sir. Okay, we got some people talking. So I would love more comments on this and questions to keep this conversation going throughout the live. It isn't a live Q&A, so I'm going to start answering questions, but I would love to keep this conversation going because I think it's been so many decades of confusion, and I am grateful that they've released things that show the benefit of hormone therapy and not just cutting it down all the time. However, I still think it's not a solve everything approach always. You do still have to take into consideration the entire body. So I want to make sure this doesn't unleash a bunch of people just injecting people full of pellets just because they have a hot flash. That would be inappropriate. We have to look at why it's happening, right? So, and then if that's why it's happening and that's what would remedy it, then, you know, you look at it at that point, if that makes sense. It still says my connection on the 3 platforms is low. I don't know what's going on. I have full bars. So I hope you guys are still seeing me over here on this camera. I know you guys are good, right? Instagram's good. All right. Happy Friday. Glad you're still doing the live with the technology outage. Oh, there's a technology outage? Well, that might explain it. I didn't know. Instagram from Florida is great. Hello. Which hormone therapy will help with severe constipation? I don't know of a hormone therapy that will help with constipation directly. Once again, that's a systemic issue. Have to look at why it's happening, right? I don't think a constipation would be happening because the hormones are low. I would think if anything, the constipation might be happening because the hormones are high or out of balance and the body's under stress and there's a toxic load and the liver is backloaded. There could be parasitic infections. There could be viral infections. There could be all sorts of stuff going on in the gut. Hormones in the gut do go hand in hand. I'm not saying they don't, but giving a hormone for constipation would not be an approach that I would take. I would look at the entire body. What does the body need? And I also wouldn't give the hormone if you're not going to the bathroom all the time, because then you can't clear excess hormones, right? Let's think about that. Constipation, what does that mean? If you're not pooping, it's like you're not taking out your garbage in your kitchen. So if that just sits there and you just keep piling garbage on top of it, it's going to cause a problem, right? If you're putting stuff down the garbage disposal and it's not being ground and removed, it's going to cause a problem, right? It's going to cause a backup, which causes more constipation, right? And it's also going to cause a high toxic load, and the liver is not going to be able to do its job. So would I give hormones to someone who wasn't going to the bathroom regularly? I actually wouldn't. Even if you showed that you needed it, I would fix the liver, the digestion first. And that may be probably a 4 to 8 month protocol, gut immune protocol, to really clean up that gut before I would even come close to giving hormones, me personally. Not saying other people wouldn't or that they'd be wrong, but at the same time, if you can't clear it out, I'm not going to put it in, right? Inputs, outputs, right? Contemplating, yes, please. Oh, good. Okay. Hormones and lymph stagnation, how to jumpstart recovery. Hormones and lymph stagnation. Are you saying you've been given hormones and your lymph is stagnant? Once again, just talking about what we were talking about with the bowels. If your lymphatic system, if you're not clearing toxins, you're not going to have as much efficacy out of the hormones. So in that case, if your lymph is locked down or you're not going to the bathroom and you're on hormones and you're not feeling any better, I would actually, I don't want to say withdraw the hormones. It would depend case by case, but at the very minimum, lower them and really, 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 really focus on healing up the lymph system, the detoxification pathways, opening those up and moving things through, because they have to be moving in order to really get the benefit out of any therapy, to be honest. So that's kind of where I'm at on that. If you want to clarify that question, I can go into more depth, but that's kind of what I'm assuming from. Are lymphatic tissues related to lower estrogen because of menopause? Are lymphatic issues related to lower estrogen because of menopause? Well, our lymphatics help clear excess hormone. They help clear toxin. They clear up the liver, right? They clear our body from toxin. So it's very much involved in estrogen metabolism, as well as toxic load and you know, stress burden on the body. So if the body has a lot of toxins in it, if the lymphatics aren't moving, if the detox pathways aren't moving, the body has a lot of internal stress because it can't do its job. And that internal stress will also have an impact on the hormones. It will also have an impact on your nutrition, right? Because it won't absorb as much nutrition, and we burn through a lot of nutrients when we're releasing cortisol. So we start to develop more and more internal stressors. So what I say to people is, you guys can learn from me and from my programs and, you know, books and things like that. You can learn a lot of how to manage and reframe the external stressors. And that's step number one. But then when you want to address the internal stressors, you have to bring someone on board to do that with you. For example, that's what I do with my one-on-one clients. I'm like, they've pretty much determined, okay, I see my external stressors. I see I'm under stress, but now what in turn has that done to my internal, right? And why is my internal, where is the stressor? Why is it preventing me from getting well or doing the symptom? And that's my job, right? Is to dive in, do labs, figure out what are the internal stressors, combine those with the external stressors, and come up with a plan for somebody to not only minimize the way that they, or change the way that they look at external stress to prevent further decline, but also repair the damage that's happened from previous stress, right? So that's why you need a provider. You can't, when people come out and they say this is only managing the external stressors, that's correct if you've repaired the internal stressors, but you have to repair those first. Then once you repair those and you've learned the tools to manage the external stressors, you can prevent further internal stressors. Does that make sense? So as far as lymphatics, I mean, if your lymphatics are not working, your body is stressed out because it can't take out the garbage and it's starting to stink. Yeah? Okay. Hello. What is hormone therapy all about? And what are the kinds of hormone therapy? So with hormone therapy, I'm speaking specifically on this study with sex hormones. So like using estrogen, progesterone, testosterone, DHEA during menopause, perimenopause, or andropause. So this has been a very controversial topic for ages. On one, are hormones, cancer promoting? Do they cause more problems? And then two, dividing that into bioidentical versus the synthetic versions, right? So we had the bioidentical camp saying, these are protective. These are helpful. If they're used correctly, this is going to improve your life, not harm it. And the other side was saying, no, it's going to cause cancer. Well, now this side is coming out and saying, these people might have been right. We're actually seeing in the studies that we're getting benefit out of hormone therapy. So now they're saying it's all good. We're sorry, we lied. Doesn't cause a problem. And now I'm coming in here and saying they're correct in that generally it's safe. However, that doesn't give you a license to just hand it out. There needs to be investigation and there needs to be an understanding of why it's needed so that you use the right hormone at the right time so that the body has benefit from it, right? Because we never want to use anything that the body doesn't need. Okay. Because it's going to give the body it doesn't need. The body's going to go, whoa, why am I getting this? I don't understand. I have this. I don't know why I'm giving it. And it's going to try to store it. So we always have to look at that. And my being an adrenal fatigue doctor and looking at the way that cortisol impacts hormones, and looking at the level of stress as a society that we are under, the level of disconnect of what we are under. Disconnect is one of the most stressful things ever. Just think about it. When you don't feel wanted, when you don't feel welcome, when you feel disjointed, when you're afraid to reach out to people, when you're afraid to say what you want to say, these are things that disconnect us from our soul, our heart, our mission, our love, our personality. And these cause stress on our body because we can't be us, right? And we're living in a world of disconnect. And I think also we're relying so much on technology to connect us that we're actually losing connection. And this loss of connection is a source of stress for our body. And our body tries to adapt to that. And then we don't feel well. And then we start giving it medications. We start doing all these quick fixes. We start adding more things onto the liver. Our liver gets toxic. Our environment is toxic. And bang, now our bodies are in adrenal fatigue, but we don't even realize it, right? And I think if we start realizing it, we really start connecting with that. Not only will the health of our country improve rapidly, but we will all be a lot happier. And I, for one, don't want to live an unhappy life. So I'm going to find a way to make the best of every single moment I have, even if it's not a great moment. Does that help explain that? And the kinds of hormone therapy could be, there's different combinations. I use compounding only. I don't use the synthetic versions from your traditional pharmacy. They have very standardized dosing in that, kind of like a birth control pill, right? Which to me doesn't help anyone. So I use it compounded. So I can compound it in cream, you can compound it in sublingual. Some people do oral capsules and pellets. I personally don't. I haven't seen as much success with that, but that's a personal choice. And obviously it always comes down to the patient. It doesn't matter me. It comes down to the patient and what works best for the patient's body at that time. So it always has to be consideration. I know as physicians, we're like, people look to us to have the answer. and we try, but it also comes down to how you feel, right? And that's an important thing. Am I still live on Facebook? You guys are way quiet over here. YouTube, LinkedIn, it's way quiet. And I'm like concerned that I'm like not even live. No, never taken hormones. Okay. All right. I just had a HIDA scan and I'm radioactive. How do I clear it from my body other than water? I would see a physician. I know you were asking about constipation. You got the HIDA scan. There's obviously some some detox pathways that need to be addressed. I would highly recommend seeking a functional medicine or naturopathic physician in your area to really, really, really investigate every single part of this puzzle. Still good. Okay, still live here. Okay, you guys are just quiet. What's up with that? Okay. Hello to everyone that's been joining in. Good to see you. I kind of catch up as I go along on who's here. So hello, I'm scrolling and catching up. Yes, I agree. My cortisol levels and stress have been inordinately high lately. I definitely feel lymphatic system disruption. Yeah, I mean, the body, right? We have the two nervous systems, rest and digest and fight or flight. And our body has to choose. So if you're running from a bear and you're in fight or flight, you're not going to be repairing your cells, clearing toxins, digesting your food. You can't because you die. You can't send the energy there. You have to send the energy to running. So this is a really important point. We can't heal unless we rest. I have a database of clients that are type A personality, almost all of them. They're hard going, want to do it now. Let's get this done. I'm going to do this perfectly type people. And I love them because I'm the same way. I'm a recovered perfectionist, I should say. I'm not like that anymore in some respects, and that's why I'm a great person to teach them how to get out of that. But what I find is they get sick and they're like, oh, I don't have time to slow down. I can't do this. I got to keep running. And I'm like, well, great. You're going to be sick longer because your body has to calm down to heal. That's it. If you want your immune system to chill and do its job and be focused on killing whatever's taking you down, you have to allow it to do that. If you keep running from a bear, it can't. Physiologically, it can't. It's got to get you away from the bear, right? So it's funny because my clients are always like, oh, no, I got to go to work. I'm just going to do that anyway. Or I'm just going to push through this. Or what exercises can I do to get through this? Or what can I do? What can I do? And sometimes my answer is, I want you to do nothing. I want you to just accept. I want you to just rest. I want you to stream Netflix. I just want you to chill out and nurture your body and give it great soup and love and support and realize that you got sick because you were pushing a little bit too hard, right? And the bug got you, right? And then in between, we work on improving detox pathways, lymphatic pathways, immune system, those types of things, so that the next time the immune system's a little bit more alert. Teach the body how to stay in parasympathetic more often so that it can heal while you're sleeping, so that future invaders don't have as much option to invade. But we can't always do anything about it in the moment. You know, any of you like that? It's like, oh my God, what can I take? I got sick. What can I take? I'm like, well, it's kind of late now. I mean, yeah, you can up your vitamin C, your zinc, your vitamin A. You can get an IV, whatever, but you're already sick. Like, the key would be to be practicing these things and supplementing and making sure your nutrition's on par before you get sick. Because then if you do happen to get taken down, it's faster when you start to replete it. If your vitamin C levels, like if this is a full vitamin C level and your vitamin C levels, the starting point is here and you get sick, it's going to take a whole lot of supplement to get you up here. But if your starting level is up here and you get sick, it doesn't take very long to kind of fill that cup, if it makes sense, right? Does that make sense to you guys? So if I can encourage anything, prep your body for that on a daily basis. Clear your lymphatics. Pay attention to your liver. Get rest. Honor your body. Tell it how beautiful it is. How many of you, especially you women, have told yourself in the mirror how beautiful you are recently? I'll wait. Probably won't have a lot of yeses here, right? How many of you have told yourself how ugly you are or how much you hate your body, right? I would really encourage you And I'm saying this from a perspective of someone growing up as a model in an industry where physical was all they cared about. I would really encourage you to really fall in love with how beautiful you are. It is very, very important because you are very, very beautiful. And there is so much beauty in who you are right now, where you are in the experience. I had a friend once, and we were talking about, wrinkles and getting older and things like that. And she's like, man, I earned these. And I was like, you know what? You're right. You did. Like, if you ever looked at, I remember when I think back to my grandmother or looking at people and there was a wisdom in their eyes, and yeah, they had wrinkles, but there was a wisdom in it. There was a security in it. There was a grounding in it. And that is so beautiful. So we have to learn to really grasp the beauty from the inside. And it is amazing how much that comes out to other people. And what you're seeing and beating yourself up about is not what other people are seeing. And it took me a very, very long time to learn that. And I still struggle with it daily because from the time I was born, I was told to pay very close attention to my appearance. And that was really important. And that's ingrained in my brain. And I have to constantly talk myself out of it. But it's been way better since I have. So on that note, I hope you guys do love yourselves and appreciate your body. And when it gets sick, it's trying to say, hey, slow down a little bit. Give me a little bit of love. Yeah. I love my face and body. I love the cup example. Awesome. 100%. All right. Changes need to be made. This is a good reminder. Thank you. You're welcome. Can you heal adrenal fatigue without hormones? Absolutely. Absolutely. No question whatsoever. The degree of when I use hormones for adrenal fatigue, usually you have to be pretty down and out for me to use hormones for adrenal fatigue, honestly. The majority of my clients, I do not use hormones for adrenal repair or glandulars. I use nutrition. I have 4 pillars, right? I use nutrition, movement, nutritional and herbal supplementation to help balance and replenishment, and mindset. Those are my 4 pillars. And guys, by the way, the challenge coming out second week in September, every day, what a part of the challenge is each one of those 4 pillars. And then the 5th day is an awesome masterclass. It's free. I'm going to start promoting it soon. Keep a lookout for it. Sign up. I think it'll be a blast. But yeah, absolutely. I rarely use hormones to heal adrenal fatigue. If I'm using hormones, it's because the adrenal fatigue is having an impact in a different area of the endocrine system that I need to support while I heal. Yeah. Cute nails, Dr. B. Oh, thank you. Do you like the green? Isn't that fun? This is Mineral Fusion again. I get it at Whole Foods. Mineral Fusion. Yeah. With their little top coat. Thank you. I went green. Little goth, I guess. I don't know. Why not? My body did not do well on bioidentical hormones. Yeah. So one of the things to think about, if you're given hormones and your body doesn't do well, it means your body doesn't want it. So that doesn't mean you can never use it. However, it just means that in that moment, maybe the detoxification pathways needed to be open first. Maybe there was some nutritional deficiencies that needed to be fixed. Maybe it was all converting into cortisol. So you got to figure out why it didn't work, or was it prescribed when you didn't really need it? Did you already have the hormone, right? So you need to look at why it didn't work. If it doesn't work for you, that doesn't mean it won't work in the future, right? Because we change, we evolve, our bodies change. Treatment should never be the same all the time. I mean, I work in concierge medicine, and it's like, yeah, I work with people really intensely for 6 months. And then, we go year by year. And, by the second or third year, what we're dealing with has nothing to do with what we started with, right? But there's always something evolving to change and grow and support, right? So if the treatment is exactly the same, then we haven't really grown and evolved, right? What are my views on homotoxicology therapy? Well, I'd have to look up what that therapy is. I'll try to see if I can. I don't really know exactly. I mean, it just basically says you're using immunomodulation to support cells. I'm not sure what they're using, if they're using a medication or an immune stimulant to do that. I'm not familiar with enough to offer. I mean, I do a lot of that type of thing with supplements. So, you know, more on a gentle level, but I'm not 100% familiar with the therapy to be able to give an educated answer, but I can look into it and maybe get back to you next week. Hello, everyone. All these people joining in. I have struggled with lymphatic issues for years and don't know how to get it cleared. I have tried to clear it, but I can't seem to find the key. Yeah. There's a lot of different reasons for why this would happen. I would really look at, you know, working with someone that can really open up those detox pathways, get you moving, and then look at killing off whatever's preventing you from doing that. There's usually something, heavy metals, viruses, parasites. Those are usually bacteria. Those are the main culprits. Yeast, those types of things. But you really have to support the body's natural detoxification first. Make sure that's working before you start killing that stuff off. So I think I mentioned to you guys before, I am looking to start a program that does that. I do it with my concierge clients now. So if you want to work with me one-on-one, feel free to reach out to my office and, you know, see what the options are that are available. It is an application process. I do not take a lot of new clients, I'll be honest with you. But if I have an opening and it's a good fit and it works with the timing, you know, I do offer that with my one-on-one clients at the moment. But, you know, you never know. I may do a group type thing too. But it's really, really important to get to the bottom of that, right? Because lymphatics clear our body. They keep our body clean. And if your lymphatic system isn't working, you gotta address it. Yeah. I'm in. I want in. Oh, for the challenge. Oh, I can't wait for the challenge. Excited for the challenge. Awesome. I'll be announcing it. So I think the challenge, if you guys want to save the date, the challenge is September 9th through 13th. So each day will challenge you on part of my 4 pillars, and it's easy. It's not like when I say the word challenge, I'm going to call it more an experience. I'm not going to torture you or anything. We're going to have fun. We might even dance a little. And I'll show up live every day to answer questions. So the lives every day will be 2 p.m. Pacific time that week. If you guys want to put that on your calendar, you do have to sign up, you know, so sign up when the sign up comes out, but it'll be Monday through Friday, 2 p.m. lives Pacific time. And then the masterclass on Friday is also 2 p.m. So I'm excited for the experience. Yeah, me too. I've never done anything like this before with you guys, and I think it'll be a lot of fun, and I think it generates community, and I think we learn a lot, and I think that's really important. Yeah. So definitely mark your calendar, September 9th through 13th, 2 p.m. Pacific time, every single day. And it's an online, like a video, a little worksheet, and a handout. Like, it's not a big deal. Okay. You guys can do it. It's meant to be fun. That's the goal. But I will start sending emails out about that. If you are not on my email list, go take my Adrenal Fatigue quiz or click on my lab list or something. Give us your email so that you get notifications. If you're someone that's unsubscribed or you don't get my regular newsletters, you want to get back on it if you want to hear about it. Or if you hate email, which, dude, I get you, then make sure you're showing up here to hear about it. Okay. Is berberine best to take in the morning with food or an empty stomach? It depends. It depends. It depends on the whole scenario of why you're taking the berberine and other factors involved. But it is technically like a food. So I don't think there's any like stark research on that. Thoughts on NAD? I have a lot of clients who do NAD injections and they love it. For energy production, just so you guys know, NAD is part of our Krebs cycle. It's producing energy for us. I don't think it's necessarily a bad thing if you feel like it really helps you get through an area of fatigue, if you have chronic fatigue. But once again, I would ask, why do we need it? Why is the body deficient? And what can we do on a day-to-day basis to correct that rather than just give it all the time, right? I'm excited for the experience. Is there a charge for the challenge? No, it's free. Dude, it's free. And so I'm way excited because it allows us to show up, meet every single day, nutrition, movement, supplement, and mindset exercises. And I'm going to teach you some things that hopefully make your life healthier, more joyful, and improve your health overall. So it's good, right? All right. So I caught up on questions. So do you guys have any more? We are talking hormone therapy a little bit today. We can talk stress. We can talk nutrition. We can talk movement. I'm trying to think if I have any more announcements, but I don't. I've been working hard on creating this challenge. The next Energy of the Total Energy Turnaround Program, the next round of that is starting in September as well. So. You guys are quiet. Oh, there we go. We're getting people joining in. Welcome. It is a live Q&A. I did actually just catch up with questions, which is awesome. I'm feeling pretty awesome about that. So if you have any questions, throw them down. And I'll start answering them. We've been mostly talking a lot about the news that came out with hormone therapy recently, where it's kind of been this back and forth on whether or not you should use it, not use it, you know. So we kind of opened with that, but I'm open to talk about anything. Some of the reels that I've been posting lately are talking a lot about a busy mind at sleep. You guys seem to like that. I want to talk about how to open detox pathways. Ooh, okay. I don't want to get overly technical here because it loses people, but there are a lot of combinations of herbs, nutrients. I use a combination of some activated carbon that basically stimulate the body to start to open up pathways. One of the number one pathways to open, okay, that you guys can all concentrate on right now. And for those of you that get like squeamish and don't want to talk about poop, sorry, because that's what this is. You have to be going to the bathroom every single day. You have to be removing toxins. If you are not removing toxins, do not start an aggressive detox protocol. Do not. Focus first on how do I have a full bowel movement every single day, if not more. That is step number one. Inputs and outputs. What are you putting in? What's coming out? That is number one. So with any of the detox protocols or, gut immune restorative programs that I do, all of them start with inputs and outputs. Putting in clean nutrition food and eliminating toxins. That is number one. So if you are not doing that, don't do anything else except that. So I have so many people, they're like, oh, but I want to take this for that and this supplement for this and this supplement for that and this and that. No, if you're not going to the bathroom, you cannot start all this other stuff. It will not work. Focus on going to the bathroom. That is number one. And I just want to clarify this for a second because a little personal story is I had a lot of issues in my teens and my young adulthood with acne, with bloating, with hair falling out, feeling really tired, getting sick, these types of things. And I'd go to the doctor and they were always like, oh, you're healthy. You're fine. This is just normal. Nobody ever asked me how often I went to the bathroom. Not once. And if they would have asked me, and I'm embarrassed to say this, that I didn't realize it, but I was a kid, right? I would have said about every 5 to 8 days for years. I'm talking from the time I was 5, as far back as I can remember, until I was 25, I went to the bathroom once per week. Nobody, when I showed up having stomach aches, right? Severe acne on my face. You know how much I paid for laser and like peels and topical products that all these people sold me on? And when I cut out dairy and started going to the bathroom every day, my skin has been clear as day since, right? Not a single person asked, not one doctor. So I want to be very clear in case this is your scenario. You have to go to the bathroom every day. Now, even funnier is that if you look at the rules, the doctor rules on what is considered constipation, they say if you go once every 3 days, you're fine. I don't want to swear, so I'm going to say baloney, but baloney. If you had a kid and they did not go to the bathroom every day, you would be at the doctor's office, right? If you're eating, you have to be eliminating. So it is very important. And you cannot repair anything else if you aren't going to the bathroom. Number one, once you're going to the bathroom regularly, just to wrap up this question, and I see some others on this, so I want to follow up on it. But once you started going to the bathroom and you know that you're going to the bathroom, you're urinating, you're pooping, you're doing whatever you got to do, then it's using different herbs at different phases that help to clear out infections. So I use a particular seed that kind of expands in the gut and helps pull parasites out. There's also a lot of herbs, and it's a combination of herbs and nutrients throughout the course of these many months that we're doing this to pull out any sort of stored viruses, heavy metals, yeasts, those types of things into the colon to go to the bathroom. So here's the thing. You can kill off all this stuff in your system, but if you can't eliminate it, it's not going anywhere. So you have to be eliminating first before you can even consider a detox type protocol. And the reason I do this with one-on-one clients and not particularly out in the open is everyone's experience is different. And I need to be there, right? I need to be there to hold your hand. I need to be there to make sure we're doing the right thing. I need to be there to pivot because it doesn't always go as you plan, right? I'm in month 4 of my recent detox of clearing my pathways, opening up, killing things off. I have about 2 weeks left. I feel great. I love it. I'm bright and cheery, skin's clear, feel good. Okay, I had some questions here, so I want to go back and make sure we wrap up that. I hope that helped answer your question. I was concerned because I don't have a BM every day, and my doctor told me some people just don't poop every day. It's fine. Seriously, absolutely wrong. No. By the way, I also want to remind you that if you are under stress and you're running from a bear all the time, you're always, right? Are you going to stop and go to the bathroom? No. If you sit over and poop, it's going to eat you. You can't do that, right? So keep in mind, the adrenals are involved in this. A lot of people say, well, I take magnesium and I don't go to the bathroom. I take vitamin C, I don't go to the bathroom. I take laxatives, I don't go to the bathroom. Okay, what's the number one thing that can override all of those? Cortisol. Cortisol will always, I'm going to say this 1,000 times, cortisol will always win. Stress will always win every single time, because if it doesn't, you're not here anymore, right? So if you're trying all these things to go to the bathroom, there's a bunch of other factors involved here that I'm not going to go into as far as backed up levels, expansion of the gut, reasons why maybe you can eliminate. Those need to be addressed, but you have to have cortisol under control, because you're not going to go to the bathroom effectively. Or if you do, it's going to be so minimal because you got to get back on the trail and run. Yeah? Does that make sense? Do you know of any reliable tests for tick-borne infections? I don't. It's not my specialty. I'm so sorry. I know that it's a very controversial area, and there's not a lot of specialists that really understand tick-borne diseases, but definitely look to the functional medicine world here, because there are people who 100%, that's all they do every single day is tick-borne. I refer out. Not my area of expertise. Now, I've had people who have had Lyme disease or tick-borne disease, they've remedied it, and then they come to me to help them build their adrenal health back. But as far as active disease, it's just not something that I treat. Do you have ticks in Arizona? I know they're a big deal in Ohio. Not really. Up north, yeah, like maybe Flagstaff, northern Arizona area. Certainly not. I mean, we have them in Phoenix, I'm told, but it's not a major concern here. We're more worried about valley fever. Recommendations for a food sensitivity test. There's a bunch. They're getting better at those. I definitely would not use your big labs like LabCorp or Quest at all. Wouldn't even consider those. I've used Immunolabs. I've used Alcat. I've used Alitests. Genova. Who else? I think Great Plains Mosaic has one as well. Just keep in mind, a food allergy test is a great tool. It's not an all-in-one solution. So it does need to be put into the larger picture when it comes to treatment and not the only factor involved. Cool. Herbs that kill E. coli. There's quite a few actually. Let me see if they rattle off my head. Sometimes they don't. I do believe oil of oregano does, although I use oregano a lot for strep and staph, the gram-positive organisms. I do believe berberine does. In the urinary tract, I think uva ursi does a pretty good job with E. coli in the urinary tract. Why am I not thinking of them? It's because I'm put on the spot. Yeah, those are the ones coming ahead at the moment. There's a bunch, but also the location of it would matter as well, because like if it's the urinary tract, there's other things you can do in conjunction with it, like D-mannose, that'll help detach the E. coli from the wall and flush it out. So it's one thing to kill it, but you also want to get it out of there. Versus if the E. coli is in the sinuses, like I get great success from oil of oregano when it comes to sinuses. So sometimes the location matters too. But you know what kills E. coli a lot? A big one is a good probiotic. Right? So like my total probiotic's a great one for that. Actually, I don't know why that didn't come to the top of my head. So preventatively, our body can actually kill E. coli, and we always have a low level of E. coli, floating around, and it's controlled a lot by our good bacteria and our gut health. So it is important to focus on gut health as well. Bladder wall. Yeah, I use D-mannose mostly for that. You can look that up. All right, I'm going to take my last question and then I'm going to head out. I see a question here, so I'm going to answer it. And then we're going to abort for the day and come back next week. Great questions today, guys. Let's get this one done here. A female friend has been struggling with reoccurring C. diff infections. I'm wanting to help her. What can I suggest for her? So C. diff is a tough bacteria because it's usually caused by multiple antibiotic use. So it grows in environments that antibiotics won't kill, right? So I actually get great success with the exact protocol that I was just talking about, which is doing a full 4 to 6 month recovery of the immune system and the gut health, and using a wide combination of herbs, nutrition, probiotics. One of the most researched probiotics on C. diff is Saccharomyces boulardii, which is in my total probiotic. I don't know, do I have one up here? I probably do. So this does have Saccharomyces boulardii in it. You can also get Saccharomyces simply by itself. That's the best. That definitely needs to be consistently in the regimen, but there's a lot of other things you can do. And it's more about just basically resetting the gut and immune health. It is a long haul. C. diff is not quick. It's a long haul. I have a client, it took us, she's still my client now after many years. And this was maybe, gosh, this might even been like 5 years ago. She had a really, really bad outbreak of C. diff. And it took us a good year to really get a hold of it. But it has not come back. She's good now, but I mean, it was an aggressive, closely working. We talked a lot because there was a lot of stuff to modify as we went along, but, she's doing really well now. So it is possible, but you do need a physician who is going to be all in with you for sure. I wouldn't just be like, oh, we'll just go to the doc every 6 months. No, like it's an ongoing thing. And I think it requires somebody that's really, really focused on gut health. So I definitely would stay in the functional and naturopathic world with C. diff for sure. I hope that helps. All right, guys, I guess I can go back to dancing, right? Listening to some music, getting some stuff done for the day. But I was listening to a lot of Billie Eilish earlier. So I guess that's what I go out with. And I don't even know if you guys can hear it, but anyway, I can't have it too loud anyway, because, the world gets mad if I copyright things. So anyway, I will see you guys next week, same time, same place. And thanks to all of you who showed up and asked questions. For those of you that were new here, please come back. If this was helpful to you, share, subscribe, follow, whatever you got to do, and come on back next week. And I will have more information on my challenge experience in the next couple weeks. Much love.